So some of you may have gotten sick, but it wasn't COVID, wasn't the flu, but the symptoms were very similar. CNN's Mandy Gaither explains how you can protect yourself from this other virus that's spreading across the country.
It's called human metapneumovirus, or HMPV, a little-known virus that's wreaked havoc on the U.S. this spring, filling some hospitals with young children and seniors, according to the CDC.
The symptoms are identical almost to influenza and respiratory syncytial virus.
Those symptoms include a hacking cough, runny nose, fever, and shortness of breath. At its peak in mid-March, nearly 11% of tested specimens were positive for HMPV.
What is most concerning is the fact that it has increased approximately 36% in the last year.
The virus has been around for a while. Health experts believe pandemic precautions like masking kept it at bay.
Now that we've let down our defenses, now that we are not as cautious, all these viruses, think of it this way, where they're just waiting to pounce, and indeed they are pouncing.
Most people who caught HMPV probably didn't even know they had it. Sick people aren't usually tested for it outside of a hospital or ER. Unlike COVID-19 and the flu, there's no vaccine for HMPV or antiviral drugs to treat it. Instead, doctors care for seriously sick patients by tending to their symptoms.
The best treatment is precaution and prevention.
Health experts say that's why it's important to be aware of this virus, especially if those most vulnerable to it get sick.
Monitor them. If they get sicker, for example, if they become short of breath, if their fever spikes up above 100 and 103 or 104, they need to go see a physician.
I'm Mandy Gaither.